roundtable discussion on exploring healthcare trends and technology in healthcare. I'm Karen Cox, Director of Global Partner Strategy for Microsoft's Healthcare and Life Sciences team. And part of my role is working with partners across the globe in helping to address some of the biggest challenges in healthcare for healthcare organizations and Microsoft customers. I'm thrilled to be with one of our partners today, Xtelligent, in an exciting discussion on what we're seeing in terms of healthcare trends in industry. And we're also joined by industry analyst IDC to have them share some of their interesting insights on how healthcare and technology is at one of the most exciting and interesting intersections today. So let's start with a round of introductions. I'll start with the Xtelligent team. Let's start with Andrew. Tell us a little bit about yourself.
Okay, thank you. Karen, my name is Andrew Swintsitsky. I'm the CTO of Xtelligent, Chief Technology Officer at Xtelligent.
Thank you. Thanks for joining us today. Vasil, will you introduce yourself, please?
Yes. Hello, everyone. Karen, thank you. My name is CEO at Xtelligent. Xtelligent is a professional services company and a long-time partner with Microsoft to deliver unique healthcare solutions from technology perspective to nationwide healthcare providers here in US.
Thank you for joining us today. It's a pleasure to have you with us. And I'd now like to turn things over to IDC analyst Lynn. Lynn, we're excited to hear what you have with us or for us today in terms of some of the industry insights that you're seeing. Tell us a little bit about yourself and your work at IDC.
Sure. Thank you so much, Karen. I'm really looking forward to this conversation with Vasil and Andrew. I'm Lynn Dunbrock. I'm the Group Vice President for Public Sector and Industry Ops at IDC, a premier market research and technology advisory company. And so I'm going to share with you some insights from our research around intelligent data management and how important the role of governance is, and particularly how we address the major challenges that are facing the industry today. Some really key technology trends, too, that I'd like to share with you. So first and foremost, I think it's important to look at, what are the priorities that healthcare organizations are facing? And no surprise, they really are aligning with what we call the quintuple aim. It used to be the triple aim of reducing costs while improving quality and patient experience. Then, because of all of the attention that was, to the whole notion of clinical experience and burnout, we'll talk a little bit about that as well in my remarks. We added the whole notion of improving clinical experience. That was the fourth aim. And it became so clear during the pandemic that with the disparity of healthcare, particularly for disadvantaged patients of color, that we added the whole concept of medical equity. And so you can see that medical equity, diversity, inclusion, and cultural competency has now become a third priority for healthcare organizations. But of course, there's a whole host of other super important priorities underneath those top five. And we'll touch upon some of those, particularly as we start talking about data management, interoperability, the need for these technologies that really are quite laudable for healthcare organizations to, achieve not only the top five, but all of the priorities here on the list. They do need to invest in clinical analytics and predictive care guidelines that are using AI to gain greater insights, from the vast repositories of clinical data that they have on hand, much of that data being stored in disparate systems across the enterprise. And so we'll see more investment in cloud platforms, interoperability, and of course, security is always essential as part of the foundational technologies for enabling, a robust clinical analytics strategy and intelligent data management. So there are three key technology trends that really are driving the investment in intelligent data management solutions. First is the proliferation of healthcare data. And, as a result of the meaningful use mandates, as a result of the investments in, through the American Recovery and Reinvestment Act in 2009, we've seen a great explosive growth in healthcare data. We're getting more data coming in from their patients. So it's coming in from remote patient monitoring devices, as well as wearable devices, medical imaging is exploding, and the size of those files, of course, are substantial. So there's lots of data. Much of it is unstructured, so that creates its own set of challenges. And then this whole notion of the shift to the cloud. And then one of the major triggers when we asked healthcare organizations, what was the thing that made you move to the cloud? We see that 38% of healthcare organizations reported that they just simply grew out of their data capacity. And so they needed to move to the cloud to get more room and to be able to do more things to get data to where it was needed at the point of clinical decision making. And again, the pandemic helped accelerated that need of having data everywhere because care was being provided everywhere. And of course, all within the provisions of security and privacy. And so now with all of this data and the ability to access this data and to be able to really start applying all kinds of technologies to glean insights from it, whether it's predictive analytics all the way up to artificial intelligence and natural machine processing and particularly generative AI, very hot topic. Now organizations are saying to themselves, well, how do we shift from being data rich to data driven? And we see that that's a really important fundamental shift in thinking. And so one of the things that we do at IDC on an annual basis is we write our Futuristic reports, our IDC Futuristic reports. We've actually just kicked this process off. And this is actually a prediction from last year's report. By the end of 2025, 65% of healthcare organizations will have data governance frameworks in place, prioritizing the ethical and explainable use of AI for predictive, preventive, and personalized care. And I think that this is such a fundamentally important prediction. And of course, as you will expect, we will have lots of predictions around the use of AI in our predictions report for this year, labeled 2024. So I think we're going to have a really great conversation. I'm really looking forward to chatting with Vasile and Andrew, on this topic, because it's become so important for healthcare organizations as they really think about how they might reimagine the delivery of care. Important things about being data-driven, of course, is this whole ability to address the very critical labor shortages and challenges that we're seeing. I mean, I think these statistics for nurses and physicians, when it comes to the shortages and the burnout, are just staggering. The sheer number of shortages of physicians, anywhere from nearly 40,000 to 124,000 physicians within the next 12 years will be short by. And it's even more staggering when you look at the shortages of nurses. 275,000 additional nurses are going to be needed between 2020 and 2023. And these shortages are really leading to significant rates of burnout. The statistics here you see for physicians, 63%, have expressed symptoms of burnout. And that's expected to continue to grow. It's up from 38% in 2020. And similarly, 43% of nurses expressing, that they felt a burnout in the past 14 days, according to a survey by the American Nurses Foundation. And this is having significant patient safety issues. And we're seeing healthcare providers who have spent years investing in their education and training for doing what they love most, which is caring for their patients, leaving their respective fields, and even recommending to their children not to pursue. So that problem is going to get worse and worse over years as that pipeline for new healthcare providers begins to slow down, because of this. So real important considerations for us about, how can we use technology to address this? And I think and it has to be the effective use of technology, because in the past, a lot of technology sadly has not lived up to its promise, and clinicians express a lot of challenges in using those things that don't work with their workflow. But, if we do a good job at it, and if we are able to, help smooth out some of those administrative burdens and workflow patterns, and be able to provide information at the right time, in advance to patients and to physicians, will really go a long way to, improving team efficiency and really help accelerating that data-driven decision-making, that clinicians are craving. So what does it look like to be a data-driven culture? In one of our surveys, we actually did a little bit of a self-assessment of those who were data-driven and those that were, not as data-driven. And you can see right at the top is this whole important need for data management and for governance. And, that's really key. And then providing the appropriate training for the folks using these tools so that they can really take advantage of them. And I think those are some of the critical things, that we recommend to our healthcare clients as they start to pursue being a data-driven organization. These are some of the things that you need to do. You need to make it part of the MBO for your folks and really drive the notion of, being data-driven and not just data-rich. So there's certain tools that we can put into place. And again, I think we'll have a really robust conversation to talk more about this. So just quickly in closing, there are some obstacles that folks express, mostly no surprise there, lots of concern about data privacy and security. They don't have the budget, or this lack of consensus on strategy. But if we can address some of those things, getting consensus on strategy is something that we can control. So that's first and foremost, I think, as most organizations tackle moving to being data-driven. And then there's just some investments that we need to make, being, data management, intelligent data management investments, kind of modernizing our platforms is another area. And yes, this all will take some budget and money. And of course, with the economic headwinds, I know that that's, difficult for a lot of organizations, but there are steps that we can take, that are incremental, that address some of these challenges. So I think there's a lot that can be done. And again, like I said, I'm really looking forward to the conversation with Vasile and Andrew. I think they have lots of great insights from the work that they're doing with their customers to lead us in a great conversation. So back over to you, Karen.
Hey, thank you, Lynn. That was an excellent kind of insightful summary of some of the key trends that we're seeing in healthcare. I really appreciate kind of the call out there on the trends and impacts in terms of staffing. Amazing numbers and statistics there on the number of physicians and nurses leaving the practice. Also love the theme there on being going from data rich to data driven and sharing data across the entire enterprise. So I'd love now to kick off our roundtable discussion with Vasile and talk about kind of, now that we've kind of set the stage on what some of the biggest challenges are, what do you see as some of the top business or technology priorities for healthcare organizations today? Lynn really talked about kind of improving quality, the patient and clinician experience, but also the challenge of reducing cost. How do you see kind of what those top priorities are for healthcare organizations and how they can maybe challenge them using technology?
It's a great insights that Lynn provided with all the information on their latest research. And I believe we totally support it with our latest work in the healthcare industry. What we see is that around the world, we definitely see that the care systems are struggling to deliver the quality of care and at the current moment due to a tremendous amount of population increase, tremendous amount of data increase, and tremendous amount of even though we have a lot of physicians, right, it seems like they definitely burned right now and they don't have enough time to manage all the technology and systems and patients at the same time. So we see that a lot of healthcare organizations are moving toward patient-centered needs or developing actually solutions and platform that put the patient in front of everything, right? And then it's working, because at that moment, actually, what we see is if you have enough data about patient, if you have a solution that is patient-centered, that is an amazing opportunity actually to connect, engage with that patient, and either do the proactive care system management or actually allow that patient to have a more preventive medicine actually delivered upfront versus delivered all the way when the patient becomes diagnosed with a disease. So more and more of those platforms actually on the patient engagement require data, tremendous amount of data, and Lynn is 100% correct that everything from data interoperability, it's something that I have 17 EMRs and I need to connect all of them. I have basically clinician work burnout. How do I help them actually to process that data, because there is no way you can process with the system in place that you had in currently. And the most important is how do I process all of that data? What I do with it? How do I trust that data? Do I have quality data? So I believe the biggest struggle from the business perspective we can see is to give the most care and at the lowest possible cost, where the technology is being trying to deliver a solution to follow those business needs, and it's happening. And the most important item that we can see right now is definitely happening. Technology interoperability and actually data processing at the tremendous volumes is the key to the patient-centered approach that industry is taking now.
Great insights there. Thank you so much for sharing those. I love what you said about kind of the intersection of data, but having volumes of data, but making sense of it, like making sure it's structured, making sure that you're leveraging those insights for your clinicians and to help improve the patient experience. I'd love to turn things over to Andrew now. Andrew, as Chief Technology Officer at Xcelligent, you've got a wide breadth of experience with technologies and solutions, but I'd love to kind of hear, how have you seen or heard of healthcare organizations effectively leveraging technology to address specifically clinician, caregiver, nurse burnout? How are they leveraging those technologies to help support frontline workers today?
Thank you for the question, Karen. So within the industry and what we see that our customers are doing, they're heavily utilizing two technologies, the RPA, robotic process automation, and also the remote patient monitoring. So as you know, the RPA involves usage of all sorts of bots to automate the routine and like manual tasks, like whether if there is a pattern or like a workflow, it can be automated. And then with this automation, healthcare clinicians, frontline workers can have free more time out of their workday and focus more on the patient care-centric activities, right? Like things like appointment scheduling, data entry, claims processing, all that routine kind of boring, but the work that needs to be done stuff has been shifted completely to the robotic process automation and shifting that burden of the people where they can have more quality time to spend on their patient, which increases the overall job satisfaction and also reduces the burnout. With RPM, all the wearable devices and solutions, like we mentioned in their research, it helps to kind of prevent the unnecessary hospital visits, at the same time making sure that people are more aware and managing their health. And because people are not going into hospitals for each and everything, they know exactly what's going on. It reduces the load on the frontline workers and the care physicians, where they can focus on the more complex and critical cases, right? So
yeah. Great examples there. And I love that you started with how healthcare organizations are leveraging technology specifically to reduce the administrative tasks, the operational tasks, starting with use cases that really kind of are really quick wins in terms of kind of helping to reduce the stress on their staff, but also kind of help alleviate the burden and allow more time, quality time with patients. So great examples there of how organizations have started to leverage technology, AI technologies as well. I'd love to kind of pivot back to Lynn. Lynn, Andrew just talked about how technology is working with some great examples on operational and administrative assistance there, but talk to me a little bit about what you see technology doing in terms of improving access to care. Any great examples or learnings that you'd like to share there?
Oh, sure. And I'm so glad that Andrew mentioned the administrative piece, because I think that's so contributing to a lot of the moral injuries that healthcare providers feel, that they're spending more time doing things that were not what they went to medical school or nursing school or whatever their allied profession is, to just spend their whole day kind of at the typewriter. So really good examples there. From a greater access to care, of course, the pandemic accelerated the investment in a lot of connected health technologies. Andrew mentioned remote health monitoring, but virtual care is another example that a lot of folks had to avail themselves of using at hospitals and healthcare organizations made a fast pivot to be able to use platforms like Teams in order to be able to see their patients virtually. And while some of them have shifted back to in-person care, we do see a significant number of healthcare organizations and patients expressing interest in continuing to being able to receive or deliver care in that fashion. So close to 20% of consumers in one of our consumer surveys said that they would like to continue using that, having virtual visits with their healthcare providers. And of course, when you start looking at younger age cohorts, that number goes up to like something like 27%. So, there's definitely a keen interest, and it has a lot of advantages for healthcare organizations, certainly from a patient perspective. They don't have to take time off from work. They can, don't have to arrange for childcare or transportation. So lots of obvious benefits for them, but from the healthcare organization standpoint, the ability to efficiently see patients, to be able to ensure compliance with chronic care, because patients often will defer those appointments if something they feel more important comes up in their work life or daily life. But those are important appointments to have. So having a quick 10-minute conversation with a patient, or being able to, follow up on CT scans and other things for, say, oncology patients. You may not necessarily want to drag them into the hospital and have them be exposed, because they're immunocompromised. And then also it really helps eliminate, people no-shows, or at least reduce the number of no-shows. And that is a considerable cost to the organization. So lots of benefits for virtual care. We're also seeing an uptick in wanting to do remote patient monitoring, again, because of the whole managing patients with chronic conditions, the use of chatbots and conversational AI in that manner to be able to have people check their own symptoms, be triaged to the appropriate level of caregiver, whether they go from through that triage of symptoms, you need to talk to a nurse, you need to actually come into the emergency room, or, being, especially with mental health, being able to have speak with a coach, and then again, triage to the appropriate level of care. So all really important, examples. And I know Microsoft has been at the forefront with its health bots, and, that was quite used extensively during the pandemic. So I think there's lots of ways, mobile health applications being another one that, we can use technology to increase access to care.
Great examples, Lynn. Thank you. Some of the technologies that you mentioned are some that I went from never using prior to the pandemic to using now every day or every week, scheduling appointments virtually, remotely, don't have to call the office anymore. I just look for an appointment that's available and schedule myself, which is great. I love the convenience there, but also kind of visits and pre-op visits, doing those virtually, all great examples there of how we've seen the acceleration of a lot of these technologies and improving access. Vasul, how about you? Anything you'd like to add to what Lynn has shared in terms of technology improving access to care?
Agree with Lynn on a lot of comments that she made, all great ones, especially I like one that telehealth was drastically moved up during the COVID days, but then it started to go down. People wanted to see a doctor in the office. And then we were thinking about it and, talking to our healthcare partners and what's the reason for that. And what we identified that patients weren't able to, during the telehealth visit, to provide enough data, right, to give them enough input on their state. And then the second major shift in the industry started to move with the remote patient monitoring. And with any consumer-grade device right now, Apple Watch, you get anything that is actually on your wrist, on your own finger or anything, that will provide that input that will make the telehealth visit much more mature and much different. Right now, you will have a data that is actually patient can bring in during the next past 24 days, and the doctor will see exactly what's happening, right? You don't need to ask the leading questions. You don't need to know a lot of what's happening. So what we see, a combination of technologies that are being developed together right now, they support each other, again, to the level that patient-centered approach actually that the healthcare organizations are taking. So exactly, telehealth and the future consumer devices on the RPM is the big boom in the industry now. Agree.
Thank you. I'd like to kind of continue the conversation there and extend it into the growing interest in AI and machine learning. You know, Andrew talked a little bit about examples like learning language models and remote patient monitoring, RPM examples as well. With the growing interest in AI and machine learning technologies, what do healthcare organizations really need to consider when they're preparing their data to leverage these technologies?
Very important questions, right? Everybody's at the end is trying to reach the focus of value-based care, better outcomes for the patient, right? And what a better outcome for the patient is basically a collaboration between a patient, the amount of data we collect about the patient, and the end result that the doctor can process in a much faster way instead of analyzing terabytes of data. So I believe what's happening right now is ML and AI is being used extensively just to sort out data, identify patterns, look inside of the data, trying to deliver the insights that a human is not able to process due to the volumes of data, right? So the data interoperability that we bring in brings so many points of data that just to connect them, I think that that's where the technology of ML and AI helping it tremendously. And what we see more and more that a development of care pathways, of treatments and different type of areas where the specific data points across time series of couple of years actually being delivered, organized, managed, and understood in a level that actually a human can make more predictable solution and much faster. So the care pathways that we're seeing that being developed in the healthcare right now are amazing in the sense that they understand all the history behind that the patient had, and then what's the progress in front. And imagine another one. Doctors are working tremendously hard, right? And they daily see patients. Does it leave enough time for them actually to catch up with all the know-how and all the different technologies and basically all the healthcare items that showed up in there? I mean, of course not. They're not catching up with a lot of new technologies and a lot of new different things. So the technology brings the new medicine inventions to them, right? And brings them and tell them that the specific research is available, the specific technology is available. So helps them tremendously to develop and finally have a co-pilot by them actually supporting their decision making, supporting and giving them enough evidence to make that decision. So I believe in the next couple of years, we're going to see tremendous explosion of this co-pilot-like capabilities for the physicians to make their decisions on the new technological advancements and on the previous data for the patient.
Wonderful. And when I think about kind of where do organizations need to get started, I also advise or suggest, along with all the great advice you just gave, is also if you don't have a governance body in place that kind of talks about when you will employ AI, when you will not employ AI, that's a great kind of practice to first get started, is just to kind of have within your own organization a kind of a governing board with some principles about when and when not to leverage AI. And then the second piece of guidance I would suggest is just, to put a human in the process somewhere along the line to kind of check in and have maybe the final kind of stamp on some of those workflows if you are automating, is kind of put a human in the middle of it, just to kind of keep the process under quality control, and while the models are still learning, it's always a great idea to have a human eye or human check on there as well. So great. Well, I'd love to kind of close out with one final question to the entire team. So I'll start with Lynn, where we kind of started with Lynn, and love to kind of close here with a question to close us out. Lynn, when healthcare organizations are getting started on their journey with kind of being data rich, data driven, as you've talked about, leveraging AI technologies, where do you think they should invest first if you had to give a piece of guidance or advice?
I think one of the things that's really important before they begin their investments is really stop and think back, what is the organization's mission? And then aligning strategies with that mission. And then what are the technologies that you need in place to then implement that vision and execute upon that vision? I think sometimes, and particularly with the new exciting technology, whatever that quote unquote new shiny toy is, it's off. I cover connected health as part of my research, and people got really excited when the smartwatches came out, and ran full bore. Let's get smartwatches, or let's get this wearable or that wearable, and they didn't step back and do kind of, let's look at this holistically. What is it that we're trying to solve? Let's articulate using smart objectives. And so they ran right, and then encountered problems. And it's the same with being data rich and moving from being data rich to being a data driven organization. You don't want to make a whole bunch of haphazard and now very expensive investments. So, what does that strategy look like? And the governance, as you referenced, particularly around AI initiatives, but certainly data governance and is also super critical. And so I think it's important to kind of get your house in order a bit there, understanding where all of your data is, and then start making the requisite investments, because each organization will be different depending upon where they are in the maturity of using certain technologies. If they're not on the cloud yet, they're going to be at a different stage than someone who's all in and digital first. So that's where I would start with folks is what's the real strategy at hand, what's your mission, how do they align, and then start making technology decisions, working with partners to help them do that. So that's what we recommend to our clients.
Great guidance there. Thank you, Lynn. Andrew, anything that you'd like to add?
Yes, thank you, Karen. So I totally agree with Lynn that everything should start from the business strategy, and that data business strategy should be developed and kind of going from top to bottom. Where are we going? What is the vision? How are we going to use and utilize the data within the organization? And then start from the basics, like you need to build the solid foundation, like know your data. You need to discover all the pieces of data that are residing in the organization, make sure that you understand where the data is coming from, what is the use of the data, business use, how we are protecting the data from the technology side, right? And then it will kind of give you the big picture. Okay, I have this type of data. These are my storages or the different systems that I have my data in. And then you can start building on top. Okay, this piece will go to AI. Here we can use the automation to help us to analyze the data. Start from the basics type of thing.
Wonderful. Thank you so much for that advice and guidance. I think they're great examples there for organizations joining us today on where they can start their journey and things that they should consider as an organization. I'd love to kind of thank our entire team here for joining us today. The Xceligent team, Andrew, Fasil, so honored to have you partner with us today. IDC analyst Lynn, excellent insights, and really appreciate your guidance and your expertise and kind of lending some suggestions on where organizations should get started, but also highlighting the trends that we're seeing in healthcare today. And then, of course, I want to thank our viewing audience. Thank you for joining us. If you have questions or want to continue this journey, it doesn't end here today. I'd love to kind of stay connected. Make sure you reach out to either the Xceligent team or the Microsoft team to learn more. I'd love to kind of turn things over now to the Xceligent team for any closing remarks, and Lynn as well, if you have any other kind of closing thoughts that you'd like to leave the audience with. I'll start with Lynn first, and then we'll hand it over to the Xceligent team to close us out today.
Well, thanks, Karen, so much. Like I said, I really was looking forward to this conversation. I thought it was, just really very enlightening. And I always learn something from talking with folks like Andrew and Vasile. I think a lot of it is, start with the basics. Like I said, kind of underscoring the whole, understanding the mission, aligning the mission with the strategy, and then, with the investment in technology.
Great. Thanks,
Okay.
Lynn.
Thank you, Lynn, Karen. Amazing conversation. Thank you. A lot of insights again on what's happening in the industry, and as we all can see that I believe it's not only the providers and the patients see the shift in their relationship, but also payers are jumping in and they're understanding the importance of preventive care, something that is going to happen before they will actually have to pay for the disease management actually when it's being fully developed. So all those technologies that we were talking about here, from telehealth to the remote patient monitoring, are being supported by Medicare, Medicaid, and many providers actually as an additional sources of revenue for the healthcare organizations. And that is a tremendous help to adopt the technologies that actually weren't available, or actually the healthcare organization had less funding at this moment. So keeping in mind the business goals of the patient quality and the patient data that actually healthcare organization can monetize on. And the monetization for the healthcare industry is simple. It's a better outcome for the patient. It's the better outcome of that treatment that they have in place. It's extremely important. So our organization is working with a lot of healthcare networks actually, and hospitals and smaller providers actually, to support their journey toward digital transformation, how to reach the best goal of patient first and best outcome for the patient goal in their organization, and to become more competitive with technology, because that's what's happening right now. So we're here to support you, and Microsoft has an amazing ecosystem to support that too. So let's go on that journey together.
Great way to end the call today. Thank you so much. If you're listening today and would love to get in contact with the Xceligent team, please reach out with the contact information we have here for additional information. I want to again thank our panel today, Andrew, Vasile, also Lynn. It's been a great pleasure talking about these trends that we're seeing in healthcare and the intersection of technology to help solve some of our biggest challenges. With that, we'll close the call and say thank you.
Take care. Thank you.
Thank you.
Thank you, guys.
Is it done deal, done deal? Are we okay? Somebody's going to edit this. We need to remove a few things here or there, but otherwise, it was a conversation. Karen, can you hear me?
I can hear you. I don't know where the rest of the team is, and if we can stop the recording, that would be great.
I think we can stop the recording.
Oh, we still had 15 minutes to spare.
I stopped recording, so we